Every 15 minutes, another man is diagnosed with prostate cancer. But here's what doctors aren't telling you. When caught early, the survival rate jumps to over 98%. Today, we're revealing the 10 warning signs your body might be sending you right now. In this essential health guide, you'll discover the critical early symptoms of prostate cancer that too many men dismiss or ignore. We'll break down exactly what each symptom means, why it happens, and when it's time to talk to your doctor. By the end of this video, you'll have the knowledge that could literally save your life or the life of someone you care about. Welcome to Financial Area, where we bring you life-changing information beyond just finances. Your health is your greatest wealth. If this information helps you or someone you know, make sure to like this video and subscribe to our channel for more potentially life-saving content. Let's get started. When it comes to prostate cancer, knowledge truly is power. Let's begin by discussing some of the most common urinary symptoms that could be early warning signs. The first sign to watch for is painful or burning urination. This sensation isn't just uncomfortable. It could be your body sending you an urgent message. When cancer causes the prostate to enlarge, it can press against the urethra, creating not just difficulty but actual pain or burning when you urinate. While urinary tract infections or other conditions might cause similar sensations, persistent pain during urination demands medical attention, especially in men over 50. Don't dismiss it as just getting older or a temporary problem. This pain occurs because cancer cells can obstruct normal urinary flow or even invade surrounding tissues, triggering inflammation and discomfort that won't resolve without proper treatment. Next on our list is frequent urination, particularly at night, a condition doctors call nocturia. Are you finding yourself waking up multiple times each night to use the bathroom? While occasional nighttime trips are normal, consistently needing to urinate more than twice during your sleeping hours could indicate prostate issues. The science here is straightforward. As the prostate enlarges due to cancer, it compresses the urethra, reducing your bladder's capacity to hold urine and triggering that urgent need to go more frequently. This isn't just annoying, it's a warning sign. Try keeping a simple log of how often you're getting up at night. If the pattern is increasing, that's valuable information for your doctor. Remember, disrupted sleep doesn't just leave you tired. It impacts your overall health and quality of life. Perhaps the most alarming sign is blood in the urine, medically known as hematuria. This symptom often appears in more advanced stages of prostate cancer and should never be ignored. The blood may be visible, turning your urine pink, red, or even dark brown. Sometimes, it's only detectable through laboratory testing, what doctors call microscopic hematuria. Either way, seeing blood when you urinate requires immediate medical examination. While kidney stones or infections might cause similar symptoms, blood in urine could indicate that cancer has invaded the urinary tract tissues. Don't wait to see if it happens again. Make that appointment today. Another critical warning sign involves problems with your urinary flow. Do you find it difficult to start urinating even when you feel the need? Does your stream stop and start or seem weaker than it used to be? These issues occur because an enlarged prostate creates physical obstruction of the urethra. You might also experience the sensation that your bladder hasn't completely emptied after urination. In severe cases, some men develop urinary retention, the inability to urinate at all, which is a medical emergency requiring immediate care. These symptoms develop gradually, which is why many men adapt to them rather than recognizing them as potential cancer warning signs. Now, let's shift our focus to pain signals that might indicate prostate cancer, particularly when it has begun to spread beyond the prostate itself. Persistent pain in your back, hips, or legs can be an indicator that prostate cancer has spread to your bones. This type of pain has distinctive characteristics. It's often deep, aching, and doesn't improve with rest or typical pain relief methods. It might be most noticeable at night or when you're lying down. Why does this happen? When prostate cancer metastasizes, the bones of the spine, pelvis, and upper legs are common destinations for cancer cells. These cells disrupt normal bone function, causing pain that can be easily mistaken for arthritis, sciatica, or simple muscle strain. Men with unexplained back pain should be particularly vigilant. As studies show, they have a significantly higher likelihood of receiving a prostate cancer diagnosis within the following year compared to men without back pain. Rectal discomfort is another symptom that men often hesitate to discuss but shouldn't ignore. The prostate gland sits directly in front of the rectum, so when cancer develops, it can invade this neighboring structure. You might experience a sensation of pressure, fullness, or actual pain in your rectum. Some men report discomfort during bowel movements or a feeling that they need to have a bowel movement, even when they don't. These symptoms occur because the enlarged prostate or cancer that has spread beyond the prostate can physically press against the rectum or even grow into rectal tissues. Any persistent rectal discomfort deserves proper medical evaluation. Don't let embarrassment prevent you from seeking potentially life-saving care. Pain while sitting, especially on hard surfaces, might seem trivial but can actually signal prostate problems. Think about the anatomy. When you sit, your body weight presses directly on the pelvic region where your prostate is located. If the gland is enlarged or inflamed due to cancer, this pressure can cause significant discomfort. You might find yourself constantly shifting positions, preferring cushioned chairs, or standing instead of sitting when possible. This discomfort tends to worsen the longer you remain seated. While there are certainly other causes for this type of pain, when combined with other symptoms we're discussing, it becomes an important piece of the diagnostic puzzle and a clear signal to visit your healthcare provider. Sexual function changes can also indicate prostate issues, particularly painful ejaculation. This symptom occurs because the prostate plays a crucial role in producing seminal fluid. During ejaculation, muscles in the prostate contract to help expel semen. When cancer affects these tissues, this natural process becomes painful. The sensation might be sharp, burning, or aching, and can occur during or immediately after ejaculation. Many men find this symptom particularly troubling and embarrassing to discuss, but remember, healthcare professionals deal with these issues every day. Painful ejaculation is never normal, and always warrants medical attention, as it directly signals something is wrong with your reproductive system. Beyond localized symptoms, prostate cancer can also cause systemic effects that impact your entire body. Sudden, unexplained weight loss is a classic cancer symptom that shouldn't be dismissed. While many men might welcome dropping a few pounds without effort, losing more than 5% of your body weight within 6-12 months without trying is cause for concern. This happens because cancer cells are metabolic powerhouses that consume enormous amounts of energy. Additionally, advanced prostate cancer can release substances that alter how your body processes nutrients. Your appetite might decrease, or you might feel full after eating very little. Some men also experience nausea or changes in how food tastes. If you've lost weight without dieting or increasing exercise, especially if you're experiencing other symptoms we've discussed, schedule a medical evaluation promptly. Finally, loss of bladder control represents both a possible symptom of prostate cancer and a potential side effect of treatment. As a symptom, incontinence occurs when growing cancer presses against or invades structures that control urination. You might experience occasional leaking, difficulty stopping urination once started, or even complete loss of control. Studies suggest that up to 25% of men face some degree of incontinence after prostate cancer treatment, making it crucial to discuss this possibility with your doctor before treatment begins. Though embarrassing, incontinence is medically significant and shouldn't be hidden from healthcare providers. Various treatments and management strategies exist, from specialized exercises to medical devices and surgical options. Understanding your personal risk factors is an essential part of prostate cancer awareness. Age plays a significant role. About 60% of cases are diagnosed in men over 65. Family history matters too. Your risk doubles if you have a first-degree relative with prostate cancer. African American men face higher risk and often develop more aggressive forms of the disease. Genetic factors like BRCA1 and BRCA2 mutations, known for their connection to breast cancer, also increase prostate cancer risk. Your lifestyle choices impact risk as well. Research suggests diets high in red meat and full-fat dairy may increase risk, while foods rich in lycopene, like tomatoes and cruciferous vegetables, broccoli, cauliflower, may offer protection. Regular exercise increases risk. Maintaining a healthy weight, being physically active, and eating a balanced diet rich in fruits and vegetables represent your best preventive strategy. Regular screening is crucial for early detection. Current guidelines recommend discussing prostate-specific antigen (PSA) testing with your doctor, beginning at age 50 for men with average risk, age 45 for those with higher risk, and age 40 for men with multiple risk factors. Annual digital rectal exams are also important tools in early detection. Remember, These examinations might be momentarily uncomfortable, but they can literally save your life. If you experience any of the symptoms we've discussed, don't delay seeking medical attention. When you make your appointment, be prepared to discuss your complete medical history, family history, and a detailed description of your symptoms. Note when they started, how they've changed, and anything that seems to make them better or worse. Your doctor will likely perform a physical examination, including a digital rectal exam, to feel the prostate directly. Blood tests, particularly PSA testing, provide valuable information about prostate health. Depending on these initial findings, your doctor might recommend further tests like specialized imaging or biopsy. When communicating with healthcare providers, honesty is essential. Many men feel embarrassed discussing urinary or sexual symptoms, but remember, your doctor has heard it all before. Being forthcoming about your symptoms enables accurate diagnosis and appropriate treatment. Consider bringing a written list of symptoms and questions to ensure you don't forget anything important during your appointment. Let's summarize the 10 warning signs we've covered. Painful or burning urination, frequent urination and nocturia, blood in urine, problems with urinary flow, pain in your back, hips or legs, rectal discomfort, pain while sitting, painful ejaculation, unexplained weight loss, and loss of bladder control. Any of these symptoms warrants medical attention, particularly if you're experiencing more than one. The key message we want you to remember is this: early detection dramatically improves outcomes. The 5-year survival rate for prostate cancer caught in local or regional stages exceeds 98%, but drops significantly when the disease has spread to distant parts of the body. Don't let fear or embarrassment prevent you from seeking potentially life-saving care. We encourage you to share this information with the men in your life. Prostate cancer remains a topic many men avoid discussing, but awareness saves lives. Start those conversations, even if they feel uncomfortable at first. And thank you for watching this important health information from Financial Area. Your health truly is your greatest asset. If you found this video helpful, please like and subscribe to our channel for more content that could change or even save your life. Until next time, stay vigilant about your health